welcome to Brazil, welcome to Bahia, welcome to COP. My name is Ethel. I've been the focal point of the Planetary Presidency for Nexus 5, which is fostering human and social development, in which we have the objective 1716, which is promoting resilient health systems. So we are very happy to have you all here. These thematic rooms, they are an innovation of the Planetary Presidency. We did not have this previous COPs. So we are very excited to have you all here. We hope you enjoy this event. So I'm taking a very quick video and then hand it over to Josh. Welcome and enjoy.
Have you noticed how the climate crisis is already changing your life, your daily routine, your health, our country, our entire planet? But we are changing too. Now the world is coming together in a global effort to speed up this transformation. Follow COP30 in Brazil. Visit cop30.pr.
Hi everybody. We made this room hot just to really motivate you. I'm Dr. Courtney Howard. I'm an emergency physician from the subarctic. I'm the chair of the Global Climate and Health Alliance and the founder of POWER, Planetary Health Organizations for Wellbeing, Equity, and Regeneration in Canada. So we're here to talk about tipping points for good and bad in this health sector. We know that in the Amazon, we are close to a negative tipping point. There's a risk, as scientists tell us, that we could tip from forest to savanna, from carbon emitter to carbon absorber to carbon emitter. That is something that will have impact on the entire world. Where I live in the subarctic, it may seem far away from here, but in fact the 2023 Canadian wildfires that forced the evacuation of my 100-bed subarctic hospital created enough air pollution that it resulted in over 82,000 global premature deaths, according to an article published in Nature magazine by Zhang et al. So that catastrophe really brought home for us that all of our health depends on this beautiful collective system that we call Mother Earth, and that we're all connected. Here, we are going to talk about the positive tipping points in the health sector. Jim Lenton, who led the Global Tipping Points report, was just here, and the health sector is one case study that he's very excited about. Many of the people in this room were part of the COP26 health program in Glasgow. Josh ran around organizing all of us along with the WHO. I tried to get Canada to sign on. We thought maybe heading in we were going to get 8 or 9 countries to commit to sustainable health care. And then we had the beautiful zero emissions ambulance from the UK parked in the parking lot. The US signed on at the halfway mark, and we got what Maria Mera from the WHO called healthy competition. And at the end of COP, we had over 50 countries signed on. Our number now grown to over 100. And that matters because we allocate, as a health sector, over 10% of global world product. We have over 40 million trusted professionals, and we have the ability through procurement as well as policy influence to extend our effect out into the world and help tip some of the sectors that are very close in electricity, transport, and food. When we look at how to create tipping points, it's all about feedback loops. And a big part of that is knowing who has made concrete wins and telling the stories of those wins, because that's what generates hope. That's what this session is all about. The Brazilian concept of Wow really illustrates this beautifully, helping us to understand how aligned work at the individual level, organizational level, subnational and national level can contribute to these positive tipping points. So we're going to start off by talking about positive work at the macro level. I'd love to introduce the director of the Pan-American Health Organization, Dr. Jarbas, Barbosa, to start us off.
Nós was around 45 degrees Celsius, so it was an extreme. Some people at that time, there was a joke going around that the government of Spain chose Sevilla, because every people there said, who is this? Who had this great idea to have a meeting in Sevilla in July? Because nobody, it's impossible to work in Sevilla in July. We go to the beach and no, the Spanish government did it on purpose. They want us to experiment a little bit what the world is becoming if you don't act now. So probably it's the same person. But let me tell you that I'm very honored to be here. It's an honor to be with you this afternoon on this historic health day at Planetary here in the Amazonia, the heart of the Amazon. First, I want to recognize our government. Healthcare is our heart. And we have also very close relationship with the Planetary Health Organization. We are using the tools, the vehicles we have provided to support the country to make measures, to promote the policies to reduce the emissions related to the national health system. And I also want to recognize the WHO's Alliance for Transformative Action on Climate and Health, and the initiative on climate action and nutrition. For bringing us together to share results that are not only inspiring, but scalable and actionable. I think that it's very important at the same time that we are sharing all the evidence, the data that we have about what's happening, but also to share what are the concrete experiences that we are implementing at the local level, so we can leverage on these experiences, we can adapt them to different national contexts and making also more sustainable progress. This morning we launched the Belem Health Action Plan, a bold collective commitment to put the health right at the center of climate action. This plan builds on a growing range of problems, from the COP26 health problem, the COP28 Declaration on Climate and Health, and the WHA, the World Health Assembly 77, to the recognition of a climate resilient health system in the global goal on adaptation and the global stocktake. Together, these milestones are creating the foundation for real transformative change. Today, we will hear from many sectors, hospitals, NGOs, private companies, and governments, all showing what is possible when collaboration fuels progress. From WHO global perspective, this momentum is essential. Our climate change and health action for 2025 sets a clear goal. By the end of this decade, every health system must be ready for climate risk and on the path to net zero emissions. As director of the Pan-American Health Organization and regional director of WHO Regional Office for the Americas, I focus on how that vision takes shape across the Americas, the most unequal region in the world and one of the most climate vulnerable. Barro, we support the member states to build early warning and response system, to train health professionals, and to develop low-carbon, climate resilient health facilities. And these efforts are already saving lives. When Hurricane Melissa struck Jamaica and hit Cuba too recently, Barro supported the smart health facilities staying fully operational. They protect patients, kept the staff safe, and continue providing care when other infrastructure fails. That is climate resilient in action. And it is proof that the investment in preparedness truly saves lives. This initiative that I mentioned, Smart Hospital, was a very important initiative to work together with the country in the Caribbean that is probably one of the most vulnerable regions in the world, with the support from the UK, and after that from European Union, and we work together with the countries and we retrofitted, we renovated, we adapted 50 hospitals and health centers that now are not only more resilient to practice will also incorporate a green dimension and also accessibility dimension to them. So we are working with them and providing this technology to the countries that are building or renovating their health facilities. Across the Americas and around the world, we still have much more to do. We must protect our health facilities from climate impacts, and we must put the health system firmly on the path to net zero, aligned with the Paris Agreement. That will take dedication, innovation, and partnership, exactly what is represented in this room here today. And as we look ahead, we must also invest in the next generation. Later in this session, we will hear from young leaders from Brazil and Australia, voices of creativity and purpose. Their energy and vision will shape the health systems of the future, systems that protect both people and the planet. Momentum for healthcare climate action is growing, but momentum alone is not enough. We must accelerate through implementation, through financing, and through collaboration. So, at COP30, let's make sure Belem takes a clear message to the world. Healthcare can and must lead the way toward a climate-safe, equitable, and sustainable future for all. Thank you very much.
Thank you, Dr. Barbosa, for that macro level leadership. And I'd just like to point out some micro level adaptation I'm seeing in our complex adaptive systems we walk around in everyday excellence, sweating, folks. I like to lead by example. I'm seeing some behavioral adaptation, some very elegant fanning, well done. One of the most elegant banners is over here and is our next speaker. I'd like to welcome Dr. Ethel Maciel to the stage to situate the macro level presidency of the COP30 within the context of health systems leadership. Thank you.
And welcome to the Belem climate weather. So, first of all, I would like to thank everybody to be here in the name of the COP Presidency, COP30 Presidency, Embaixador André Corrêa do Lago. I would like to say and echo what Dr. Jarbas just said, that doing this COP in Belem, in this weather, it's a little bit of the taste of all of you to have, to see what the people that live here, what they face every day when they are studying, working, when the young women are delivering their babies. So this is the kind of weather and a lot of areas that they face every day. So it's very important to bring all the diplomats and the negotiators in this room, in this weather, to feel how the everyday Brazilian in Amazon facing here and now. Because in the end of the day, it's for these people that we are here, and it is for these people in the forest that we are here. So although the Wellbeing Action Plan was launched by the Minister of Health today, it is a historic day for us. We are very excited to have the first adaptation plan in a Broadway that brings us the global health together. It has been like a long way, almost 2 years working this. For the Brazil, the Minister of Health, the COP Presidency, that we are already working together, and this innovative way that the Ambassador André Corrêa do Lago did call for in each sector have a special envoy to make this work as an ambassador in each area, to make this multirão, which is the Tupi Guarani work, is the indigenous work that means we need all doing things in a collective way. So this is the spirit of this COP30 in the way that we work for this long 2 years to be here. And saying that, I would like to point out that although the Belem Action Plan is building in adaptation, we also, of course, want the mitigation. We want to still doing what we need to have a net zero world, and the health sector, as you just say, it's very important to do this. And in the X3 for the plan, innovation and technology, we have this spirit that will build this new technology, this new research, building in adaptation and mitigation together. And I have a few minutes and would like to give this message that now that we have the plan, you need to implement this plan. So it's very good that we have some announced in this morning with money, because we don't do nothing without investment, without funds. And I would like to say that we are very much connected. And as Brazil launched the tropical fund Forest for Forever, this is very important because people that live in this tropical forest, they need to receive some fund to keep the forest in their place. So this investment fund that Brazil just launched here will be important for the health sector itself. So saying that, I would like to thank all of you for all their work for so many years, and say that we can count in Brazil presidency that we work for this year, for the next COP, to have some focus there. So this is what we are thinking and we are looking, and Brazil is very committed with this. Thank you very much.
Thank you, Dr. Maciel. It took us a long time to get help at the presidency level, so the leadership shown by the COP30 presidency is very, very appreciated. Coming from a place that's moving so fast, adaptation is just what's required to provide healthcare. And so the more we situate that within quality healthcare and integrate it into everything we do, all the decisions we make, the better people will be, both in terms of their overall health and the healthcare we can provide. So now, having learned about leadership at the macro level, we're going to move to the meso level, the organizational level, the level of non-state actors that can start to gather the energy that's burbling up from the bottom and organize some of this policy work that we're seeing coming down from the macro level. So to take us through that conversation, I'm going to invite long-time climate and healthcare system advocate Josh Carliner, who's the Director of Global Partnerships at Healthcare Without Harm. And I would also like, if people are getting hot sitting up, you could come sit on the floor, or if, like, for instance, you're feeling lightheaded, you could also sit on the floor or prop your feet up here if you need to do so. We have a doctor in the audience over here if anyone's feeling sad or lightheaded.
All right. Welcome, everybody. How's everybody doing? Cooling down? It's really good to see all of you here. And Healthcare Without Harm, the World Health Organization, Connecting Climate Minds, and ICANN all come together to organize this event and demonstrate positive solutions to the climate crisis that can help implement the objective of building resilient health systems. That's been articulated in the UNFCCC negotiations via the Global Goal on Adaptation, the Global Stocktake, and here today by Brazil's presidency and the Action Plan. In addition, now that the Belem Health Action Plan has been adopted and launched this morning, this is also an important moment to pivot and start identifying how, as Ethel just said, we're going to implement it. So, in this event, we are going to look at how various non-state actors on this next panel, which includes civil society, private sector, and subnational governments, are innovating solutions to achieve climate resilient health systems that can both adapt to climate change's impacts and decarbonize to align with the ambition of the Paris Agreement. We're going to start this panel with some mental health solutions related to climate change, since psychosocial resilience in the face of the climate crisis is a fundamental underpinning of a climate resilient health workforce and a healthy, empowered population that can build lasting solutions and transformative change. So to help set the stage for this first panelist, and the beginning of this panel, I want to do a collective self-diagnosis of how many of us gathered here today suffer from some form of climate anxiety. So, please raise your hand if you have some climate-related anxiety that impacts your health and well-being. Anybody? Oh, just a few people. Yeah. All right. So now, how many of you have experienced some other form of climate-related emotion, such as anger, sadness, or guilt? Okay. More people. That's getting ready to take some action, isn't it? And now, one more question. Please raise your hand if you have children, or if you don't have kids, if you know children who are suffering from some form of climate anxiety. Okay, so we've got to do something for our future generations. So I want to ask the panel to come on up here. Jessica Newberry is a Climate Health Policy Fellow from Connecting Climate Minds and Climate Care Center at the Imperial College of London, UK. Dr. Shyam Bishen is the head of the Center for Health and Healthcare at the World Economic Forum. And Dr. Juliana Otibari is from Beneficencia Portuguesa, which is disappeared. But Juliana Otibari is the sustainability manager at Beneficencia Portuguesa. Okay, great. Thank you. And please bring your chairs closer. I just kind of went inside earlier. You can see who is actually organizing this event. But I guess, so my first question, really, I asked the question already, Jessica, everybody, and how, since you're an expert in this area, how do you interpret what you just saw out there in the audience? What do you think?
Thanks so much, Josh. Hi everyone, it's really wonderful to be here. I think seeing that response just shows how much of a diversity of different emotional responses that we all hold in experiencing and living in the climate crisis. As Josh said, I work as a climate and health policy fellow in climate change and mental health, and I'm here representing an initiative called Connecting Climate Minds. Mental health has to be at the heart of building climate resilient health systems. We know that climate change isn't just a threat to physical health, but also to mental health. And mental health systems around the world already need urgently to transform, and climate change is making that need even more urgent. We need mental health systems which are grounded in communities, which are and help to promote conditions where mental health and well-being can thrive. But this is also what we need for climate action. The Belem Health Action Plan calls for full, equitable, active participation of civil society, and psychological resilience is the foundation for climate action. Collective climate action depends on connected communities, on social cohesion, and also taking part in action builds these conditions as well. So taking collective action can be a way of building the foundations for good mental health and well-being. When we talk about climate resilient health systems, we must also talk about resilient people. Health professionals are facing burnout and overwhelm around the world, even more so in the climate crisis, and systems transformation cannot happen without investment in the people who make up those systems. So at the heart of this is an aligned opportunity to transform mental health systems, to enable collective climate action, and also to build more resilient health systems. Putting mental health at the heart of climate resilient health systems requires investment and action to connect what we know with what can be done. Connecting Climate Minds is a global process funded by Wellbeing, and this is really aimed to set out a pathway and a roadmap for how to connect climate action with mental health action through evidence building that meets the needs of decision makers and also communities. And building a climate resilient health system requires really connecting diverse expertise. And in Connecting Climate Minds, we brought together 12,000 people across 126 countries to develop research and action agendas for climate change and mental health. And in this process, better connected policymakers, practitioners, civil society, and people with lived experience. We also gathered case studies of what's already working around the world, and there is so much action in climate change and mental health that can be connected, can be learned from, and can be scaled. Just to give a couple of very quick examples. Firstly, in Kenya, AgriScycling is a community-based mental health service which is providing support for women smallholder farmers affected by climate change, and really recognising that adaptation in the agriculture sector cannot happen without health and resilience of farmers. Imperial in Pakistan is a digital intervention that supports frontline communities and community health workers to recognise the mental health impacts of climate change and provide peer support. And through Connecting Climate Minds, not only did we gather stories of impact, but also led directly to it. The team who led Sub-Saharan Africa regional practice heard through our process that access to clean water and access to protected soil fertility was what would most help mental health, so providing capacity building in Nigeria, Cameroon, and in East Timor. And these are just a couple of examples of many more which are housed on the Connecting Climate Minds Global Online Hub, which we've just launched a new version of to really amplify and connect what works around the world. So really, mental health action is climate action, and there is a huge opportunity to learn from what's already out there. Thank you.
Thank you so much. We know our mental health is a super important underpinning of our work, our climate resilience and health systems. And on the other end of the spectrum, so is the world economy. And the World Economic Forum is a major player, brings together major players in the world economy. And in 2023, WEF launched the Climate and Health Initiative, which has mobilized private and public sector leaders to advance evidence and action on the impacts of climate change and health. So I want to introduce you to Dr. Shyam, Bishen, who's the head of the Center for Health and Healthcare at the World Economic Forum. And Shyam, we're here in the showcase of highlighted solutions and results, and I'm wondering what are the results and solutions so far in this initiative that WEF is the most proud of, and what are the solutions you want to achieve between now and the Global Stocktake in 2028?
Thank you, Johnson. Thanks for having me. Thanks to Forum, WHO, and others for organizing this session. It's very exciting topic for discussion here. As I said, I'm representing private sector also. Not only I represent the Health and Healthcare at the World Economic Forum, but we try to bring and work closely with private sector to bring them to the table to solve for some of the global systemic issues that the world faces. We are a public-private partnership platform. We use that platform to bring governments, public sector, both some states, the ministers, as well as civil society, academia, and others, together with private sector to solve for some of the challenges that we are talking here about impact of climate change and human health. Some of you may know us from our Davos annual meeting in Davos in January every year, where we bring together again a lot of private sector leadership. We get about 600 to 700 CEOs of large companies. Total, we have about 1,000 members of private sector that we work with. But we get about 600 to 700 CEOs. We get about 60 to 70 members of the state, and about 300 to 400 ministers from Minister of Health, Finance, and others to come together and talk about some of these key issues that faces. And one of those obviously on the side of the climate and health. Like you said, we launched this climate and health initiative 3 years ago, and at that time our overall climate work was twofold. One was to bring visibility, awareness of the issue, to highlight that the climate change impact on human health is here and now. Because just a few years ago, we were only talking about decarbonization, we were talking about mitigation. We said, well, the impact on disease areas will come, but they are not here. They are maybe they're 20 years away from now. But we realize that no, that, this is something that we need to talk about because we see the vector-borne diseases, respiratory and other diseases are increasing, and we need to make sure that there is a high visibility issue from our convening power where we bring in all these senior leaders, as well as through our research. One of the other things that World Economic Forum is well known for is producing reports, doing research with our partners, with our consultants, whether it's BCG, McKinsey, and others. And we launched an analysis of impact of climate change on human health. We published a report about 2 years ago, 12 months after launching the initiative, which again talks about the impact of climate change. We published a report that talks about additional 14.5 million deaths by 2050 on the current trajectory. So if we didn't do anything, we continue the way we are, that will cause an additional 14 to 15 million deaths by 2050. We also looked at the economic analysis, economic impact of it, which turns out to be even bigger number, huge number of $12.5 trillion by 2050. Once you publish this report, once you publish this analysis, that catches attention. Immediately, many of the private sector folks started to talk to us about, what's the impact on our employees, what's the impact on our communities, on our customers, and our bottom line. So we did another analysis to look at sector by sector, industry by industry. And I will give you an example. When we look at just three sectors, three industries, construction, healthcare, food and agriculture, it comes out to be about $1.5 trillion impact just on the bottom line economic impact. So these are some of the things I'm getting, not that my time is up, but I'll just mention two other things that we are doing and we are looking forward to. One is to look at the impact of extreme weather event on local population. So it's about place-based change, how we can look at it from locality point of view, city, sub-national, national point of view. Again, bringing both public and private sector together. And the last one is the financing part. How do we make private sector to do their part? How do we encourage private capital to invest in this? So, long way to go, but I'm quite encouraged with the discussions here. What we started in COP28 in Dubai with Health Day is continuing. We are making progress. So I'm very encouraged. Thanks again for that. Thank you.
Thank you, Shyam, and we're looking forward to big things for Jarbas on the floor. So I want to pivot the panel a little bit to talk about health and healthcare, which is sort of where healthcare without harm sits in this world. We lead two initiatives that are working to achieve climate resilient health systems among non-state actors. One is the Healthcare Climate Challenge that we launched at COP21 in Paris 10 years ago, and the other is Race to Zero for Healthcare. The Healthcare Climate Challenge is, in a sense, the first step up the ladder of healthcare climate action. It's where hospitals and health systems can commit to mitigation, adaptation, and leadership. And Race to Zero, which we launched in collaboration with the UN High-Level Champions in Glasgow at COP26, is a high-bar initiative within the challenge. And members commit to achieving net zero healthcare and reporting on it. So I'm pleased to report to you today that the Healthcare Climate Challenge now, 10 years later, has over 500 members representing 30,000 hospitals and health centers in 53 countries who have made these commitments to mitigation, adaptation, and leadership. And our commitment is to continue to grow this cohort and build healthcare leadership in the fight against climate change. In working with this growing group of members, we aim to protect health facilities that provide services for more than 100 million people. The Race to Zero, our leading edge cohort of hospitals and health systems committed to net zero, is growing rapidly, especially in the global south. So new members are coming from countries as diverse as Brazil, India, Colombia, Mexico, Argentina, Thailand, Indonesia, Kenya, Ghana, Egypt, Nicaragua, and Malaysia. And today, I I am very pleased to announce that in the past week, we've been joined by 2 new members, meaning that Race to Zero for Healthcare now has 100 institutional members. These 2 new members are Presbyterian Church of God and Health Services, and wait for it, our 100th member is Hospital do Coração from Brazil. These members now represent the interests of 15,000 hospitals and health centers in 28 countries. And our ambition is to increase this number to 200 institutional members who are reporting on their progress and committed to net zero by the next Global Stocktake in 2028. So now we're going to hear for the rest of this panel from 2 Race to Zero members. The first is from Brazil, and the second will be a video from India. So I want to introduce to you Juliana Opipati, who is the Executive Manager of Government Relations, Social Responsibility and Sustainability from Beneficência Portuguesa, a Race to Zero member based in Sao Paulo. Juliana, the floor is yours for 4 minutes.
Thank you, Josh. It's a pleasure for us to be here and sharing our experience in this discussion so important for the future of healthcare. Beneficência Portuguesa is one of the largest hospitals in Latin America. We receive around 250,000 patients per year. But as a philanthropic hospital, our health service goes beyond our headquarters. We have a partnership with the Minister of Health in Brazil, and we help 2,100 municipalities with more than 25 programs in education, healthcare, and research. Just this year, we will help more than 1 million people so far in those programs. Our climate agenda started several years ago, but it has intensified in the few years, the 3 past years, with the partnership with the Projeto Hospitais Saudáveis that represent in Brazil the healthcare without harm and the Global Green Health Network. There are more than 500 hospitals in Brazil and more than 70,000 hospitals in the world, so we can learn a lot with this network. And they lead us, they challenge us through toward mitigation, adaptation, and resilience. 2024, we joined the Race to Zero campaign, and now we have results to show. Regarding to the decarbonization, we did several actions, but the major one was to eliminate the nitrous oxide, that is an anesthetic gas with a high climate warming potential. Now, 1 year before, we can measure it, and we have a reduction of 89% in our Scope 1 emission. So we are being recognized for those actions. We just received the Race to Zero Global Award in climate resilience, but we know that we need to go beyond. We are experiencing in our hospital the climate crisis. Last year with the dengue, our hospital overcrowded for 4 months. It's a reality that needs to be quick response. After that, we decided to build our climate risk metrics and our adaptation plan. But now we think we can help the government with those learning that we have in the private sectors. In the partnership with the Minister of Health, we were already doing some actions that help with the Belem plan. Like we trained 28,000 health professionals to fight tropical disease. We have 20 different specialties in telemedicine for 3 states. And we think together with the Projeto Hospitais Saudáveis, we can help the private, the Ministry of Health to take and transfer this know-how that take the system to the public hospitals. So, Beneficência Portuguesa, it's open to dialogue and in favor of fair healthcare system.
Beleza, muito obrigado, Juliana. So our next panelist couldn't join us in person, but we have a cut-down version of a really great video that he recorded with us. And this is a small hospital, so we just heard from a really big hospital that's doing Race to Zero. This is a small one. Dr. Sushil Jatana is director of Lombard Memorial Hospital, which is a 100-bed facility in Karnataka, India. And so we chose it to feature here because we want to demonstrate that building low-carbon, climate-resilient health systems can happen in all different kinds of healthcare settings. So we're going to run the video right now, and I'd like to ask our panelists to leave the stage and the other panel to prepare to come on.
In the summer, there's extreme and in the monsoon. We've had heavy rain, we've had sometimes very fast rain, sometimes very fast rain, and occasionally floods as well. In fact, we have seen the effects of all these things in our OPD every day. Every day we've seen increases in asthma, in COPD, in heart disease, and dengue and malaria as well. In India, 80% of hospitals belong to the small and medium-sized category like ours. There are a wide range of initiatives that are available to us to tackle and mitigate the risk of climate change. The first and foremost I would highlight is about use of renewable energy. Amongst this, for us, the solar is the easiest and most visible of initiatives that we can take. The results of this are immediately available in our own bottom lines because of the resources that we save, financial resources that we save. Secondly is about improving energy efficiency. They use simple things like the use of LED lights, air conditioners and fans which are eco-friendly. These are simple measures that we can all take. Although I'm a doctor with a public health background, I found the literature extremely valuable. They were either too complicated, complex, or not relevant to India. And at this time, when I was looking for help, there were two organizations who actually came forward and helped me. And that was the Public Health Foundation of India with its Health Network. HELP stands for Health and Environmental Leadership Platform. In fact, they had a galaxy of experts and advisors who could help me on the way forward regarding various aspects of climate change implementation. Secondly, it was the Healthcare Without Harm. In fact, we have used the Healthcare Without Harm's Climate Impact Checkup tool, which was very simple to operate, and not only that, they provided us with the resources in terms of trying to measure the carbon emissions for the baseline measures. Since then, we have been submitting data to the Race to Zero network, and we are confident that we will achieve the 50% reduction by the year 2030 and net zero by the year 2050. It's going to be a challenge, but we hope we are up to the challenge of making an impact on sustainability in our hospital. The impact of climate change is not a short-term fix. It's a long-term solution.
Okay, storming the stage now are our state actors. So, long-time head of the Climate and Health Unit of the World Health Organization, Dr. Jared Campbell-Lindgren, who has been an absolute stalwart, persistent, thoughtful, kind, and very fast on a bicycle leader at this intersection, is going to help us see how the country level commitments are driving change at the meso and the micro level inside those nations.
Thank you so much, Courtney. Thank you for the very kind introduction. I have to say, when you started talking, I didn't recognize myself up until the point you said bike, and then I thought, okay, I'm in the right place. So, first off, it's an absolute pleasure to speak here. Muito obrigado to our partners in the Brazilian government who have done an absolute fantastic job of elevating, continuing to elevate the profile of health for the climate discussion. I have a couple of jobs to do here, and I know for jobs. Okay, can I check? Is that any better? Perfect. So So I have a couple of jobs, and my main instructions from Josh is do them fast. The first is you have a quick, I would say, crown partners listed on this slide, the organisers of this event. One of them is not represented here, and that's the ICANN. WHO is a partner within the ICANN. This is the Initiative for Climate Action in Nutrition, and it was launched by the Egyptian government and has been part of this progression elevating the connections between health and well-being and climate policy within sequential COP presidencies. So you've heard a lot about British leadership in the Glasgow COP, the origins of the attach. That was followed then by Egyptian leadership in connecting these essential issues of nutrition and climate, because we can't control our climate emissions unless we're promoting sustainable and healthy diets. And for us, that's a really important thing because it takes health outside just of the health system, outside of the health sector, and makes it clear that we can only have a healthy population if we act on the determinants of health. So I love ICANN. I also like the positivity of the name ICANN. It's pretty good. I'd like to go one better. I'd like to go to we can, because the other message I wanted to get across is this is absolutely a collective effort, and it's a collective effort about solutions. We already heard in the introductory part of this presentation when we were talking about mental health that one of the things that actually makes the mental health of young people better when they're thinking about climate change is to talk about actions, is to talk about solutions. There is a quote from Greta Thunberg, which I'm probably going to get wrong, but it was something along the lines of, you people come to us youth asking us for hope. You start acting and hope is everywhere. The hope is in the actions. So that is what we're here to talk about. We've heard fantastic comments already from different stakeholders from the private sector and NGOs, and I'm about to turn to our government representatives as well. I have one final point on this. A good friend, an epidemiologist, told me very recently that the appropriate balance of negative messages to positive messages when you're trying to inspire action is 3 parts joy to 1 part doom. So I'm the doom, I'm the one telling you it's all bad. I have hopefully 3 instances of joy as we go along the panel. So positive actions from the government level on climate change and health. I'll start, if I may, with you, Andrea. Andrea to my right. Andrea who I have your title right, Director General for Climate Action Policy in the Ministry of Environment. You're a negotiator. You're actually supposed to be here. You're actually a part of the real business. So I'll hand over to you, please.
Thank you so much, Shyam. And first off, thank you for having me. Thank you, Josh, for inviting me. Some of you know me from my time working for Healthcare Without Harm. I am now in the Mexican delegation, but I choose to feel as very much as part of this community. So thank you for having me. The last time most of us saw each other was in COP29 in a WHO Pavilion event. I had just made the switch to the Mexican government and I said we will try to make our NDC 3.0 health-oriented. And here's your joy. I think we've delivered on that. In many ways, but I think the most important one is that our NDC is now 1.5 aligned. We have approved our NDC. It's not submitted yet, but for a very good reason. And that's because our president, Sheinbaum, wanted to write the foreword herself. She is a climate scientist and she was very much involved in the process. And so it is very soon to be submitted, but what I can already tell you is that our 2035 targets on mitigation have been presented in absolute terms for the very first time. And there's 11 models backing where we've set that target so that it was placed exactly where 2035 intersects with our trajectory towards net zero emissions by mid-century. It's presented in the form of a range, and the upper and lower extremes of that range basically depend on whether we reach net zero in 2050 or in 2055. So it's a science-based NDC, and I think that's where we're heading. A very strong push for sustainable mobility, sustainable agriculture and transition away from fossil fuels. In a way, this is the most ambitious administration in terms of transitioning into renewable energy. Our NDC states that we will reach peak emissions in the electricity sector by 2027 and go downward from there. So very significant effort, I think, from the Mexican government to align our NDC with a healthy future. But this will not be enough. Just beginning of October, we had torrential rains affecting Mexico severely. 5 states were very much affected. There were, very sadly, 87 people died from the flooding. That's non-economic loss and damage right there and then. That's nothing that we can monetize. But also a lot of health system infrastructure was affected in these 5 states. So we're also responding to this in 2 ways. One of them is including a whole section on climate resilient health systems under an adaptation component, which entails epidemiological monitoring, health system infrastructure resilience, and capacity building. A very, very important part of that capacity building aspect of it has to do with closing the data gap. I'm very proud to say that we've used the Lancet Countdown indicators to inform our NDC, and they are going to be playing a very important role in the creation of our very first National Adaptation Plan, which is now in the works. We hope to have it submitted by August 2026. And this, and I'm pitching up just by saying that we also have introduced a brand new loss and damage component into our NDC to deal with the health impacts of climate change as well. So hopefully that's a bit of joy for you, but I will in closing say means of implementation are key. Our targets are presented in both conditional and non-conditional terms. Whether or not we manage to get the cooperation we need from spaces such as this will determine how ambitious we can be. Thank you.
Perfect, thank you. Thank you so much. Yes, so centre means of implementation. Thank you very much. If I can turn to you, Stephen Bauhaus, Assistant Secretary in the Department of Environment and Climate Change in the Australian Ministry of Health. Potentially a forthcoming COP president, we'll see. And over to you, Stephen.
Thank you very much. We were a bit late to the health and climate agenda. It kicked off for us in 2023. One of the early things we wanted to do was develop a strategy to work out what we wanted to do. There were lots of good ideas that we need to prioritise. We also wanted the buy-in from our community sector and from our states and territories, which are a big part of our government. So we went out and we consulted widely for a year, put together a strategy. And that really stood us in good stead to go forward with a range of actions. So we've got 49 actions in the strategy. We're a good way through that. We've got about 19 of those completed, 23 in progress. So we're trucking our way through the strategy. My main message is, well, a couple of key points. For one, the need to consult to really get people on board. But also there are a lot of quick wins in this. Like, you think it's all hard and you have to change the overall energy infrastructure, and that is part of the piece. But there's also a lot of quick wins. So, for example, Brazil talked about just fluorine, which is an anesthetic gas, which we're also really working to phase out. There are lots of other alternatives. It contributes a lot to greenhouse gas, so that's a phase out. We also found from talking to our hospitals that there are a lot of nitrous dioxide piping through the hospitals. They've been put behind walls and nobody checked it for a long time, and they were leaking everywhere. So about between 80 and 90% of a lot of the hospitals we checked had the nitrous dioxide just going out into the atmosphere. So if you shut off that nitrous dioxide and you move to cylinders, or even if you just check the valves and do proper maintenance, you're reducing carbon emissions quite significantly. So my main message is do the consult, work with your states and territories, work with your community sector, go talk to people. There are some hard things, sure, but there are also some quick wins. Thank you.
Wonderful, thank you so much, Stephen. Extremely clear, bring people with you. Concrete action, take the quick wins and move on from there. Thank you so much, Stephen. So finally, on this panel, I'll turn to Andrea Connell, who's Deputy Director for National Antan in the Ministry of Health?
Welfare and sport.
Health, welfare and sport. Thank you so much, Andrea.
Thank you very much. And I believe there's a slide that was going to be projected. When it comes up, you'll see that symbolises what for us is very important in terms of government working together with health providers and health professionals to on the challenges. Is there a slide? Okay. So, this was taken at the Green Health Festival recently, and I'd like to acknowledge the presence of Dr. Ethel in the room who has led this movement. So in the Netherlands, we're taking a three-pronged approach, nationally, bilaterally, and multilaterally to work on the challenges of climate change and health. And thank you for the opportunity to share a few concrete examples. I'm going to whiz through them. So just to say that for us, building resilience is more than about adaptation, but of course it's important to work on protecting people from the health impacts of climate change. One example is that since 2007, in the Netherlands, we have had a heat surveillance and emergency response system, and this is linked to our national heat wave plan. After its introduction, health-related deaths fell from roughly 40% of the attributable mortality risk from hot days. They fell by 40% and dropped from 17 to 7%. But real resilience is about tackling the root causes, and that's why we need to work on mitigation as well. One example is the green operating theatres. We've heard some examples about the anesthesiology, but also in terms of energy use, we know that by expanding humidity limits, lowering ventilation rates, outside working hours, and switching room classifications where possible, we can cut the energy use of operating theatres by some 70 to 80% without compromising patient safety. So I think that's a really good one. Another one is related to medical waste, and we have an initiative in the Netherlands called PharmaSwap, which is an online platform of different pharmacies, hospital pharmacies, collaborating to make use of medicines that are almost beyond the expiry date. It's saving money, it's saving medicines and waste, and it's making us less vulnerable to disruptions in the supply chain. So those are our national efforts. We learn and we develop and we scale up by working bilaterally and multilaterally. We have a global health partnerships program, and in that we're working together with Kenya on climate resilient healthcare, learning from them on water and drought management, and we're collaborating on sustainable hospital guidelines in line with the WHO attached guidelines. And together with China, we've been working on reducing the emissions and waste in hospitals. And if you can imagine, in the Netherlands we have about 80 hospitals. China, you're looking more at 30,000. So the cooperation we're doing on reducing the anesthesia, not using those polluting gases, is having a huge impact through that bilateral cooperation. We're currently working on new partnerships, for example with India, and are open to other partnerships. So who knows, maybe with Brazil. We need to learn a lot from you on dengue and Zika, the illnesses that will be coming to the Netherlands quite soon. Finally, the Netherlands, together with Peru, championed the new resolution on climate change and health. We're following up on that now, also in these negotiations. We would love to see health more mainstreamed into the FCCC negotiations, and there are various ways to do that. We're happy to cooperate. If I've spoken too quickly and you haven't followed all of this, Evelyn and I have prescriptions for a sustainable healthcare system, and by following the QR code, you can get to the solutions I just mentioned, and many more. So thank you for your time, and congratulations on keeping cool.
So much. Thanks so much, Andrea. Thank you so much to all of the panel. I think you'll agree we have more than enough solutions. We've gone every scale, from individual operating theatres up to international negotiations, scale hospitals, and finally, through health conference style, we finish with the prescription. Fantastic. Thank you so much. Another round of applause, I think, please.
Thank you so much. Josh. You know, as someone who's done this for a long time, having the power of government with the ability to spend taxpayer monies to set policy, it feels like the grown-ups are finally in the room. And I don't know about you, but that decreases my climate anxiety. We know that youth in global surveys have huge rates of climate anxiety, and actually one of the things that they most often say is that they've lost trust in government because they haven't taken action. So I think that not only is having governmental action to protect health good for health, I suspect it's good for democracy to prevent democratic backsliding and really have people maintain faith in the system. And at this moment in time, that is an important co-benefit that I think maybe we should be talking about more. So to bring the perspective of youth to the conversation, I find sometimes we say, and now it's the future, and we put all of the responsibility on you. That's not the idea here. What we would like you to do is inspire us with your priorities to finish off the session so we can take that into the rest of our healthy future.
Thank you, Courtney. You took the words right out of my mouth. We are ending with the future here, and we have two incredible panelists. Eric Bianco-Pelagia is the climate and energy lead for Hospitais Saudáveis, which is our strategic partner here in Brazil, and Bianco Lau Goodchild is the youth lead for the Climate Health Alliance of Australia, which hopefully will have the next COP assigned to it, and is Healthcare Alliance strategic partner in Australia. And we're running up on time here. We're kind of going over a little bit, but we want to try to keep this going as long as we can. And so I want to ask each of you, you've both been doing incredible work in the lead up to COP, work in Australia on climate and health, on climate resilient health systems. Where do you see the work going? What's your vision for how this work should evolve? Everything we've heard, with all this momentum that's happening in governments and non-state actors, with these big international institutions, the COP presidency. Let's start with you, Eric. Where do you see it going?
All right, thank you, Josh. So, trying to keep it short, I think like one of the most important things that we must do is to broaden this debate. Of course, COP is a huge forum, very important space, but if we don't get people outside of these walls, these hot walls, we are not going to succeed. We were discussing earlier this morning about the Belem Health Action Plan, but there are so many other plans that are in place, and if we do not get people and healthcare workers, healthcare patients that convinced of that message, all those plans, all those documents, they are going to be kept as plans and documents. So this year we have, and I want to give a salute to my friends of the Health and Climate Network. We've been working with many organizations here in Brazil to bring up this movement. Climate is health, health is climate, and we even organized a political manifesto that aims to broaden this debate and also get more support towards those causes. And in a conceptual level, in a way that we want to debate that climate change is a major challenge to healthcare, but also in a way that we create awareness among the health community in a way that those people will support those efforts and we will be able to move forward. So this is my view for the future. And I hope that we are playing giving a small contribution towards that. Thank you, Josh.
Thank you, Eric. Thank you, Eric. Presence has made a significant contribution here in Brazil. It's been amazing to watch the work. And if you haven't checked out the manifesto, there's a QR code right up there if you want to take a look at it. Bianca, Australia and the Pacific could be the home to the next COP. My opinion, if we're lucky, that'll happen. It'd be great. That is looming on the horizon. What does it mean for the future of the climate health work in the country and region you work?
So the Climate and Health Alliance is, who I work for as the youth lead, is Australia's peak body on climate and health, and we represent over 100 different medical organisations. And I've had the great privilege as the youth lead to establish our Youth Climate and Health Council, which represents 14 different amazing young people from ages 16 to 28, and they are around not just Australia but also the Pacific region. So we have representation from Queensland, Victoria, New South Wales, Papua New Guinea and Tuvalu. And so we've had the great privilege in the past month to put together Australia's very first Youth Climate and Health Summit. And so I think looking towards Belem and COP31, ensuring that we're able to have the mobilization of action and building momentum, we need to make sure that there's opportunities for intergenerational dialogue. And so a lot of the work that I'll be doing in the lead up to COP31 is ensuring that our youth are integrated with our board and our leaders to make sure that not only they have opportunity for mentorship, but also so that our youth can inform and guide our operations at Kaha. And in the spirit of Muchida, it's our ambition to bring together the voices of youth from across our region. We've already begun this process, so just recently we were able to hold our annual conference, the Climate and Health Summit, where we brought together some amazing individuals from Aotearoa, Tuvalu, Solomon Islands, Samoa, Fiji, but we learned from a lot of our peers that it's so important to have context before context before content. Being able to build a relationship and understanding of shared purpose and creating opportunities for genuine connection so that we can collaborate effectively. And some of the challenges to this we have experienced was, I guess, for our counterparts in the Pacific, a lack of equitable access to be able to engage and participate. And so part of the building momentum for collaborative action on climate and health will be creating opportunities and advocating for equitable access so that our First Nations people and our Pacific brothers and sisters who are on the front lines of climate and health and experiencing the health impacts of the changing climate can lead the way for collective action. And our Youth Leaders Council will play a close role in shaping youth engagements with COP31. We'll be hosting a local conference of youth and bringing together the youth voices for COP31. And we will also be holding multiple youth climate and health summits to advance climate and health education, connection and collaboration. And this is how we continue to build that momentum of our youth movement heading towards COP31, given that we are the future health leaders of tomorrow.
It is so exciting to see the youth already organizing in Australia Pacific around COP31. And I met a bunch of Brazilian medical students yesterday, and just seeing sort of the incredible energy and the commitment. And even 5 or 10 years ago, that didn't exist in this sector. So I'd love to talk to you guys more because there's so much more to say. But Courtney needs to close this event, and the organizers are like looking at me with like daggers in their eyes. So I'm going to pass it on to Courtney. I want to thank you both for being up here.
Everybody, from when I met Josh 10 years ago at COP21, it is incredible the progress we've made. Over 100 countries committed to sustainable healthcare. That's the kind of healthcare I want to deliver. That's the kind of healthcare that makes being a doctor feel aligned with the work I want to do in the world. So thank you for inspiring us today with your stories. Thank you for being part of this giant, complex, adaptive system that extends through all of us from the micro level to the meso level to the macro level, right out into Mother Earth itself, herself. And what we know about creating positive tipping points is that it's all about the feedback loops. So some of the outcomes from COP are going to be in policy, but a lot of them are going to be in stories, and you are the people who will carry those stories of what you've heard here back into your communities. I've been the lonely person in the room saying the thing that other people don't want to hear many, many times. So I want you to look around at everybody who's in this room right now. And when you go home, remember the stories you've heard. Remember the courage everybody else has shown. And if you have to stand up and be that lonely voice in the room. I want you to stand up and picture everybody else in this room standing up and taking that courageous step alongside you, together in heart, if not together in person. So thank you for being in person with us today. I'm incredibly proud of the work that we've all done. I genuinely think that the health sector has a better potential to trigger some of these positive tipping points than any other sector, and what could be a healthier contribution not only to this generation, but to all of the other generations yet to come. Thank you.
So, quick shout out to WHO, to Connecting Climate Minds, to ICANN, and to my colleagues at Healthcare Without Harm who did a tremendous amount of work to organize this. Everybody, we need to leave the room as soon as possible because we're way over time. There's another group coming in here. We need to respect their space and they need to do their event. So networking outside in the hallway. Thank you very much. And thank you, Climate Champions team and the organizers of this space for being so accommodating to us. Especially Naya. Thank you.